And our topic of discussion today on My Doctor Show is the first trimester. We will be looking on or talking about all there is about the first trimester of a pregnancy. And we have Dr. Maureen Owiti, who will be taking us through some of the symptoms that there are for a woman who is pregnant, especially on the first trimester. Share with us your experience as well, and we'll also be guiding the first timers, or if you're thinking of having a baby in the nearby future, talk to us. The SMS line is free of charge, 20268. You can also call us live through the number that will be displayed right at the bottom of your screen throughout this show. Once again, we welcome you to share with us your experience during the first trimester, the first 3 months of the pregnancy. That is our discussion today. My name is Purity Museo, and you're watching My Doctor Show. But first, let's have a look at the home remedies. The SMS line is 20268. You can also call us live. The number is 0791 478 Let me repeat the number, 0791 478 In case you're joining us for the very first time, you're watching My Doctor Show, and my name is Purity Museo, and our topic of discussion today is the first trimester of a pregnancy. And joining me in studio is Dr. Maureen Owiti, who is a gynecologist at Kenyatta National Hospital. She also practices at GynaCare, right? Yeah, welcome to My Doctor Show, Doc.
Thank you, Purity.
Yes, and thank you so much for joining us. We're talking about something very interesting today, the first trimester of a pregnancy. Maybe we could just begin by a quick introduction on what is pregnancy to begin with.
Okay, I think pregnancy is when you're pregnant. I think I'm going to give one of those silly answers you give in case you ask a question and whatever. But anyway, it's when you're expecting to have a baby. And I think you're talking about the first trimester. So we usually divide the pregnancy into 3 parts. Hence the word tri. Tri means 3, and then mester. So we have divided the pregnancy into 3 parts. Mostly they're about 14 weeks each. So you find the first trimester extends from day 0, that's your last, the first day of your last period, up to 14 weeks of the pregnancy. The second trimester will extend from the 14th week of pregnancy up to the 28th week of pregnancy. And then the third trimester will be from 28 weeks onwards. I think it's the shortest because it's just about 12 weeks. Right. If we're to count from 28 to 40 weeks, which is a normal pregnancy, it'll be about 12 weeks. However, it can actually be 14 for people who have a longer pregnancy.
Okay, yes. And let's stay now with the first trimester. First, when do you get to know that I am pregnant?
Okay, really it will depend on how you conceived. So, but I think we're talking about natural pregnancies for today. Right. So normally, most women have a regular cycle that we expect our periods at the end of every month, okay? Or at least every month. So you have a rough idea that, my period, I'm expecting them, say, on the 6th of this month. 6th comes and the period is not there. 7th, it's not there. 8th, it's not there. A week passes, periods are not there. I think most women, when the period is delayed, and obviously if they have been sexually active, because there has to be that, right. that connotation, and if they were planning, then the logical thing to imagine is that they should be pregnant, that they should be pregnant. So I think the most common symptom is first missed period. Having had said that, there are some people who don't have like regular cycles, okay? And even somebody in a regular cycle, maybe they don't mark or pay very big attention to what's happening to their cycles. They don't mark the days. So if they didn't notice that they've missed a period, we now get what we call the early pregnancy symptoms.
Right.
The most common being, I think, the famous and notorious morning sickness. And I think morning sickness is one of those things whereby it's very funny because not everybody gets the issue in the morning. Morning sickness can be any part of the day, but because the majority of women get the symptoms first thing in the morning, it's why it's called morning sickness. So in the morning sickness, you start having nausea, you feel like throwing up, or you can actually vomit, and you notice this discomfort. Other symptoms will be like premenstrual syndromes, whereby you have breast tenderness or discomfort. You're feeling tired. You just feel different from the way you normally feel. So the common symptoms will be the nausea, vomiting, you're bloating, you're constipated, your breasts are hurting, things like that. So you start saying, hey, something is wrong. Some people even imagine they have a urine infection, so they go to the diarrhea. I'm bloated, or I'm having even diarrhea. What's wrong? And then the doctor just asks them what's the period. They do a pregnancy test, and voila, they discover that we're pregnant. Yeah.
And most people, when those symptoms are usually similar when they are on their menses, you know, we are still staying with the early signs for pregnancy. Do we have maybe unique features for early signs for pregnancy that are a little bit different from what someone can experience during their menses?
Which is what we said. The difference would be, in most cases, is that you'll still experience this. They're very similar. They're not different. But the difference is your period has not come.
Right.
Yeah, in majority of cases.
Okay.
We do have rare cases whereby some people, maybe the first 3 months, they may still menstruate, but that's unusual. It is possible, but it's unusual. So if you find you're getting these premenstrual symptoms and the period is delaying, then there's a high likelihood that you could be pregnant.
Okay, talk to us. The SMS line is 20268, which is free of charge. You can also call us live. The number is 0791478990. Tell us, we are talking about the first trimester of a pregnancy, and we have Dr. Maureen Owich, who is just taking us through some of the things to expect. You're also welcome to share your experience with us. What are some of the symptoms or the things that you had to go through during your first trimester? And Doc, just to stay with the symptoms for pregnancy, there are people who never get to realize they are pregnant during that first trimester because they never experience these symptoms. Tell us some of the exceptions for these symptoms during the first trimester.
Okay. A lot of people, especially where a lot of confusion comes in, are people who have been, say, on some form of contraceptive and stopped. And the notorious ones would be something like, say, the Depo, or even an implant, because you find such people, they were not getting, a lot of them were not getting their periods in the first place. So you've removed your implant, or you've stopped taking the Depo, and you conceive. And some, as you said, these are probable signs. Not everybody gets them. So they may not get morning sickness, breast tenderness, nothing. So there's nothing unusual about them. They now notice, 14 weeks from the first trimester is already over, because especially somebody who has conceived before, they start feeling the baby moving, and they're like, hiya, what's happening? So it's also understanding that in as much as some people do experience the morning breast, not everybody has to get pregnancy symptoms when they're pregnant.
Okay.
So that is possible, yeah.
All right, now we understand that during pregnancy, or when one is getting pregnant, an egg must meet with a sperm. Maybe you could now tell us from the first day or 1 week what exactly happens in a woman's body.
Okay, so those are the conditions for pregnancy to meet, that definitely an egg and a sperm must somehow get together and form what we'll call a zygote or embryo. Okay, so when a woman ovulates, and should she have intercourse within 24 hours of the ovulation or prior to the ovulation, because we know that sperm normally can stay alive in the woman's body for up to 72 hours. Okay, so if she had intercourse in what we call the not safe days during her pregnancy ovulation window, then there's a likelihood that the sperm will be able to fertilize the egg. So once the sperm has fertilized the egg, this egg starts dividing, okay? And initially, it will not increase in size, but the number of cells are going to increase. So it'll first divide into 2. You'll go to a 2-cell embryo, divide into 4, 4-cell, 8-cell, like that. And then now you find it's like, because they just keep dividing in half, in half, in half, in half, in half. Then they reach a point whereby there are certain cells that start coming with a different potential to now come with the cells that are going to form the sac for the baby and the cells that are going to form the actual baby itself. So somehow through some precursors or mediators, this happens whereby the cells now become different, because you must realize that initially if it was one cell, it was the same. Now all of a sudden, these cells start differentiating and become differently. So the cell that's for the baby will start growing.
Doc, I'll cut you short.
No
you
problem.
allow me to cut you short.
Yes.
There's already someone who is calling from Ruiru, Joyce from Ruiru. Can we pick the call first?
Sure.
Okay. Hello, Joyce. Oh, we've lost her. I'm sure she's going to call back. You can go ahead.
So, so you'll have the ones that are forming the cells that are forming the outer covering will also start secreting a fluid, and you're going to start getting fluid. And now at this stage, we'll call it a blastocyst, okay? Because it has fluid inside the embryo. And you start seeing the parts that are going to form the baby. And the cells are just going to continue to differentiate to now form the different parts of the baby. I don't want to be a bit too technical, but you must understand that, say, nerve tissue comes from a different type of cell compared to what is going to form bone, compared to what is going to form muscle, compared to what is going to form the intestine. So we have to get all these different cell lines coming about so that the various organs are going to be formed. So it's just going to continue, and then now you'll find that the embryo is now going to start increasing in size, and you're going to get your baby and the amniotic sac and the fluid which is surrounding the baby.
Right.
Yes.
During the first trimester, the first 3 months, the first 12 weeks, maybe what do we expect in terms of the baby, you know, the growth of the embryo, as you were explaining? What size and also are we talking about, you know?
Okay.
Yeah.
So definitely, within the first 1 week, it's still a microscopic structure. So it's something that, in fact, it's what you have to use a very powerful microscope to be able to see this, So that's what's going to happen. Then when it starts growing in size, you find that by the time the baby is about, let's just say 8 weeks, yeah? It'll be the size of, say, approximately a peanut, okay? And then by the time the baby is about, say, 14 weeks, you'll find the uterus is going to be the size of a pear. So it's quite a large pear, and you can actually feel the uterus on the abdomen. So the baby is just going to grow slowly. You as a person, unless because of the hormones in your body, you may or may not have the pregnancy symptoms. But other than that, if you have the pregnancy symptoms, you know you're pregnant because of the symptoms you're having. If you're not having, the baby is just blissfully growing away in your womb.
Right, and for those who have the symptoms, we've talked about a very tiny thing, you know, especially during the first trimester. Then why do we have to experience so much symptoms and all that? Because someone may be asking, you know.
Okay, no, that's a very, very good question, Purity. So your symptoms are because of the pregnancy hormone, okay? So the pregnancy hormone is called beta HCG, that's human chorionic gonadotropin. So this hormone exerts a lot of effects on your body, and that's what's going to cause all this nausea. Also, you have a lot of progesterone. You find your progesterone levels are also rising. So all those things of your breast tenderness and bloating will be more because of progesterone. So because of these two hormones, that's why you feel these effects for those who are experiencing them. Yes.
And during the first trimester, am I true or am I right to say that you have, as a woman, there are some things that you have to change in terms of lifestyle? Maybe you could take us through the do's and the don'ts for a mother who is expecting, especially during the first trimester.
Okay,
yeah.
Fine. So one, I think it's good to talk about the first trimester. Again, for do's, we would really like that women actually come to see their doctor even prior to conception, so that some of these do's and don'ts are discussed prior and are done prior. Because if you realize that maybe in the early part, they are the common lifestyle, I don't want to use the word vices, but for lack of a better word coming to mind at the moment. And the common things are things like smoking, alcohol, you understand? So definitely those are things that we'd like a pregnant woman to definitely desist from taking. And of course, if she's doing any of these hard drugs, and these are becoming a more and more reality in our society. And I think you can see even Nakada is having all those issues of drug addiction. So you'd really want that a person has stopped such activities prior and during the entire period of the pregnancy. In terms of like your work, so unless somebody has dangerous work, like maybe you're a radiologist, you definitely need lower exposure of radiation. So it would require maybe you do more office work than the actual practical clinical work. And people who work in such areas, women work in such areas, definitely it's good that should not be exposed to such items. And this goes along because I think you're seeing women are more empowered. We have women matatu drivers, we have women neuroscientists. So, I mean, we're getting more empowered and we're doing more and more stuff. So if you're working in a factory that's producing chemicals, you also don't want to be too much exposed to such things. Diet-wise, I love Kenyans because majority of Kenyans have very balanced. It's not outrageous diets. We don't eat like monkey brains, raw locusts. I don't know, maybe a few communities, but it's not a common thing. And I think right now it's not something that you'll find very common. So a basic Kenyan diet is quite good. What we did say is that for the woman to increase more in terms of her vegetable intake, again, reduce her starch intake so that we also don't get certain habits, you know, like these women who they start saying, oh, the baby wants ice cream, the baby wants chocolate, and stuff like that, not realizing that it's going to impact on the size of the baby, especially later on in the pregnancy. That stuff you get used to doing early in the pregnancy, you're going to continue doing most of the pregnancy. So we do need starch, but again, to really limit the amount of that. Hydrate very, very well. So we need to drink a lot, about 2.5 to 3 liters of fluids. Exercise, there are two schools of thought, but currently if you find more modern books are looking towards, we should encourage pregnant women to do exercise, but some old books told us to desist from doing exercise. So for me, I'm like, if you are somebody who was actively participating in exercises, I would not necessarily change that as long as I don't have any red flags, like you're having a threatened miscarriage, definitely would have to stop such activities. So, but for me, I'd say if you're not doing very strenuous exercise, I'd encourage women to learn how to start walking. Walking is a very good exercise that's not high impact, and most of us can do without much effect on the embryo. And again, if a woman exercises well, you find her labor will be much, much better than somebody who is, oh, I can't walk, I can't stand, I can't do anything. So it's just encouraging the women. So it's more healthy diet, desist from alcohol, smoking, drugs, and if you are not doing any high impact exercises, probably at least even just a brisk walk.
Okay.
30 minutes daily.
Yes, and can I cut you short?
No.
I think our caller is back. Yeah. Hello?
Yes.
Yeah, we have a different caller, Damaris from Naivasha. Hello, Damaris? Oh, no. Okay, Doc. And staying with the diet that you talked about, there is an issue of cravings that comes.
Yes.
You're craving for this, you're craving for that. I don't think you would say that. How do you overcome that? You know, what causes cravings and how do you even get to overcome that?
Majority of cravings are actually as a result of some lack of something in the diet, some nutrient or the other. So I think in Africa, you find a lot of women love these famous stones. Nataka mchanga. I think that's what people say, and they'll say the baby wants. Usually, that's an indication that the woman is lacking iron in their diet. Okay, so if you look at majority of cravings, there'll be something that's lacking in the diet. So you find currently we do supplement iron in the course of the pregnancy, also with folic acid, and I think that's the basic WHO requirement, that we should supplement for iron and folic acid. But you find a lot of private obstetricians are going to give more than just iron and folic acid, where majority of your obstetricians, that's the doctor who looks after women when we're pregnant. We know we like using gynecologist, but I think it's just easier to pronounce for everybody. So we wouldn't take offense when we're called gynecologists.
Right.
So we're going to give you a multivitamin, and in that multivitamin, you find when you get that, you find that your cravings are actually going to be much, much less, because we have supplemented for the various nutrients and vitamins that are lacking in the diet and causing the cravings.
Right.
Yes.
And I want to take you back to our discussion when you were talking about fertilization, the egg meeting with the sperm. Is there a way you can do to boost your chances of getting pregnant? And also, there are so many questions coming on how you can determine the sex of your child, and also if you want to get twins. Do we have some boosters and determinants for that?
Okay, so again, it's really discussing modern medicine. Now, in Western world, and I know people like the thing called twins, okay? Twins in medicine is actually a poor outcome, you understand? Because it's a high-risk pregnancy, because anyone carrying twins has higher chances of more complications during the course of pregnancy and delivery. So it's beautiful and wonderful. I think in the African concept, twins is something I think everyone wants to have. So we don't really want to encourage twins. In terms of majority of twins in a natural conception, would be what we call the fraternal twins. Those are not identical. We have identical twins and fraternal twins. So those ones can be like a boy, girl. So they're not identical.
Right.
So those generally it runs in families. You have a higher incidence of twins in people who have issues getting pregnant. So maybe they have some form of fertility issues, and you can have a higher incidence of twinning because of use of fertility medication. However, in a good setup, we actually don't encourage getting multiples because of the issues it's going to have impact on the pregnancy.
Yes, and allow me to cut you short now, and we pick this call from Laban from Kericho. Hello, Laban.
Hello.
Yeah, how are you today?
I am Kericho. I was asking.
Yeah.
My wife is pregnant for around 2 months.
Okay.
But she has grown a habit of sleeping too much. I don't understand what is wrong with her. Is it normal or an act of pretending?
Okay. Thank you so much, Laban. You know, the issue of men not understanding what is going on with their ladies. Please respond to Laban.
Thank you so much, Laban. I think like all men, very distressed. No, she's not pretending. It's the pregnancy hormone. If you're in Mombasa, you'll find the old shoshos there will tell you high possibility of a girl. However, I am not going to put my money on it. That I don't know what the relationship is, but that is not gynecological. I can tell you. Right. I can tell you for sure. But definitely, it's just the changes that are occurring in her body, and you find that the woman can be more tired and feel more tired than usual. So just support her, just encourage her, and The beauty about pregnancy, it's going to end and you'll get your wife back after the pregnancy.
Right. So she's okay. But is there a way, because his concern is there a way, you know, we can prevent this, we can avoid her sleeping for too much?
As we said, it's just to ensure that you're just living a healthy lifestyle. So it's just to encourage her. It's just to encourage her, and she should be able to get out of it. But you shouldn't blame her too much. Some things are beyond your control.
Okay, and
yes.
I'm told Damaris is back. Hello, Damaris.
Hello.
Hi, how are you?
I'm fine.
Yeah, we are good too. Go ahead.
Okay, I wanted you to connect me to the doctor.
Damaris, just reduce the volume of your TV, then
Okay.
yes, go ahead.
Okay, I was asking.
Yeah.
I got a baby 1 month ago, and she was diagnosed with Edward syndrome.
Okay.
I just wanted to confirm what was the cause and how I can prevent it.
Okay, thank you so much. Yeah.
Okay, thank you very much, Damaris. And I'm really trying to understand her. It's very challenging, and that's one of the really challenging things we have in modern obstetrics. So Edwards syndrome is a genetic malformation in the baby, and this is something that occurs around the time of conception. So this is a genetic disorder. In terms of prevention, what she'd have to go through is actually quite a lot and also quite expensive. There's nothing we can do to actually prevent the baby getting Edwards syndrome other than her going through a whole IVF cycle. And then in the IVF cycle, she's going to do what is called PGD, that's pre-genetic diagnosis, right, whereby some samples are going to be taken from still a very small microscopic embryo. They're going to do like a biopsy, and they're going to do the genetic test, because we know we're looking for specifically Edwards and other common genetic malformations in the baby, and only put back babies that don't have it. But in terms of a natural conception, it's limited. But the interesting thing is that even if you have a child with a previous genetic malformation, it's not to say that all your offspring are going to have the same. But we can't know. So other than doing the procedure that I have told her, there's actually no other known way of doing it naturally.
Okay, so what should you expect during the first trimester of your pregnancy? What are some of the things that you should avoid or do to just ensure that you and also your baby is okay? That is the discussion that we will be having when we come back for the second part of My Doctor Show. But most importantly, we will be receiving your calls and also responding to your questions. Just keep them coming. The SMS line is 20268. On Twitter at EbruTV Kenya, the hashtag MyDoctor. The call line is displayed right at the bottom of your screen. We will discuss that when we come back, so just stay with us. Welcome back. You're watching My Doctor Show. My name is Purity Museo, and our topic of discussion today is the first trimester of a pregnancy. What should you expect? What are the do's and don'ts during this time? Talk to us. You can also share with us your experience. The SMS line is free of charge, 20268. Call us live, 0791478990. In studio, we have Dr. Maureen Owiti, who will be responding to your concerns. Welcome back to the second part of My Doctor Show.
Thank you, Purity.
Yes, and we can begin with questions, picking a few. Is it true if you are born twins, you also have chances of giving birth to twins?
Okay, there are chances of giving birth to twins, but you find a majority, again, it also depends on what type of twins they are. So if you have identical twins, this is something that's not genetic. It just happens on its own, sporadically. It doesn't choose when and how it's going to happen. Majority of fraternal twins, usually it follows from the maternal line, that is through through your mother. And in most people, it actually skips a generation. So I don't know about yourself, but personally, I'm also a twin. My brother and sister are twins.
Okay.
But my grandmother was a twin, but of her 12 children, she didn't have twins. And out of her 12 children, it's only 2 of her grandchildren, so 2 of her children who have twins, but one is one of her male offspring. So we'd say that most probably is through his wife's line, whereas for my mother, it's, I think, through her mom.
And we have Kathy, who is online. Hello, Kathy.
Hello, how are you?
I'm okay, and you?
I'm what?
Okay.
I'm currently 13 weeks, and I've been having a lot of bloating and a lot of constipation. And it's so uncomfortable. So how do I go about it?
Okay, thank you, Kathy.
Okay.
13 weeks.
Thank you very much, Kathy. And again, as I said, it's due to the hormones. And the best way to go about it is, again, diet. So again, we usually are going to recommend a high fiber diet. So that's your leafy green vegetables. Eat a lot of that and a lot of fluids and walk. Because by walking, you're going to increase the intestines, what we call gut motility. And you're going to evacuate the gas and also evacuate the stool, and you'll be more comfortable. If the natural ways of going about it, also avoid, you find certain people have certain food that tends to bloat you more. So I think for us, beans, I think that's the biggest common culprit. And there are certain foods that are going to reduce bloating, things like pineapples. And so eat less of stuff that bloats you as a person. For each individual, you can find it's different. But eat less of stuff that tends to bloat you, especially when you're not pregnant, and more of stuff that increases. So you have even interesting things. I think a lot of Kenyans like beetroot, pawpaw, and stuff like that will increase your bowel movements. But main thing is leafy green vegetables, a lot of water, and exercise. If it doesn't work, just see your gynae. They'll be able to prescribe some medication that will help reduce your discomfort.
Okay, and I am Eddie from Saika. Would like to know more about iron and why my wife is having muscle pull.
Okay, so again, muscle pull would not necessarily be because of iron, but again, there's a relationship. You have other micronutrients like magnesium, phosphorus. So as I said, you find that a lot of obstetricians are going to give you the multivitamin that will contain at least some elements of these micronutrients, and you find a lot of those muscle cramps can be reduced.
Right.
Again, water. Water, I think, is the only panacea, a panacea being a universal cure. Every disease, take a lot of water, and you find it's going to increase. So even hydration, muscles that are not well hydrated are also going to get a lot of cramps. So again, I cannot really underscore the importance of hydrating well. And just to be specific, it's 2.5 to 3 liters on a daily basis.
Let's pick one more question because we want now to have a look at pregnancy and weight, But hello, my name is Alice and I have a question for the doctor. I had a miscarriage last year in December and I'm trying to conceive again with no luck so far. How long does it take for the body to get back to normal after miscarriage, and what can I do to increase my chances of getting pregnant?
Okay, so thank you very much, Alice. Again, a lot of factors have to be looked into, but I'd also just like to really encourage her that if she had a miscarriage in December, we're in May. It's only 5 months down the line. And I'm sure initially her doctor must have advised her not to try to conceive immediately. Your body, if all things are constant, actually goes back to normal. And even you can find within 2 weeks of a miscarriage, you can actually be pregnant again. Having had said that, we only say it's unusual if she has been trying to conceive more than a year, and again, she has to meet certain parameters, that she's having regular intercourse with her partner. So that's about, on average, 3 times a week and on alternate days, not on any form of contraception. And the time frame is actually a year, so she still hasn't yet done the ideal time for us to start getting concerned. A year has passed and she's not yet conceived, definitely be a concern. So for her, I'll just say she's still within the window. Let her just follow the instructions, and I'm sure in a soon enough time she should be able to conceive.
Right. And so, Doc, let's talk about pregnancy and weight. During this time, some women tend to lose a lot of weight, others gain a lot of weight. First, why is it so? And then how does it affect the mother and also the baby?
Okay. So let's go first with the weight loss, because I think majority of women are going to have weight loss. Now, if you find because of the pregnancy, you may not even be vomiting, but you smell any food and it just smells terrible, you're not going to eat.
Right.
So they have reduced appetite. So obviously, if you're not taking what your body requires, the obvious thing is that you're going to lose weight. So it's kind of like a natural diet you've been put on.
Doc, just allow me to cut you short.
Yes.
Yes, we continue shortly, but we have one caller who is calling us. You can hear what she has to say. Hello. Hello, Maggie.
Hello.
Hello, how are you today?
I'm good.
Okay. Go ahead.
Mi sijai
Okay.
na sijai abort, but for 3 years now tumeshinda kushika ball, so nilikuwa naweza nitapata usaidizi. Then niko na infection, so nilikuwa naweza pale naweza kuwa zote.
Okay. She's talked about two issues.
Okay.
Yeah.
So I've heard the issue of the infection and the issue of she's trying to conceive.
Yeah.
So definitely for the infection, that is something immediate. She should go see a gynecologist, be checked out and treated appropriately for whatever infection. I'm not quite sure that it was a urinary or a pelvic infection, but her doctor should be able to assist her with that. On the issue of conception, definitely 3 years, if she has been doing what we have said, that she's engaging regularly in intercourse, definitely that is a big cause for concern. She should see her doctor and get an evaluation for that. If she does not have a gynae, she's welcome to talk to the producers to give her my contact.
Okay.
Okay.
Thank you for that. We can continue with pregnancy and weight.
Yes.
We
were talking about weight loss.
Yeah.
So you find, as I've said, because of the pregnancy hormone, you have the nausea, the vomiting, and because of the nausea, you have reduced appetite, you're not eating. So it's quite obvious that you're going to lose weight. Now, if you add that you're also vomiting on top of all that, definitely, even the little you're going to eat, most of it is not going to be absorbed. So you'll find in the first trimester, a good number are going to lose weight. We have the opposite spectrum whereby they can gain weight. So the weight gain will be due to, one, just the physiological changes that are occurring in pregnancy. And also, like, if somebody is not having nausea, she's not having vomiting, and she's having cravings, she's increasing what she's eating. I think it's just obvious on that alone, she's going to gain weight. Now you find during pregnancy, because of progesterone, she's going to increase the amount of water she's retaining. So that again can account for a lot of the weight. And also you find your blood volume, your cellular volume, a lot of things are going to increase. So that again can account for an increase in weight.
All right, maybe we can hear from Lily from Gilgil. Hello, Lily.
Hello.
Hello, hi, how are you?
I'm fine, thank you.
Okay, go ahead.
I wanted to ask the doctor. I was using family method, which I don't know, it's called how the 5-month family planning.
Okay.
Okay, and I removed it. It was last week, but once. And I was asking the doctor, is there any possibility that I can get pregnant this fast?
Okay, thank you, Lily.
Yeah.
Yeah, issue of family planning and pregnancy. Yeah.
Okay, I didn't get when she stopped the contraception.
Last week, but one.
Last week,
She's
but
saying,
one.
yeah.
Okay, fine. If her pregnancy test is positive, yes, she can be pregnant, because also understanding that even when you are on a method, there's still a possibility that you can conceive when you're still using a method. Obviously, the probability is much lower than somebody who's not using a form of contraception, so most probably. So if she stopped 1.5 weeks ago and a pregnancy test is already positive, then the likelihood is that she's had a method failure and has conceived while using the contraception. In terms of how fast can one conceive, as I've said, the moment you stop using a reversible form of contraception, your fertility returns immediately. So yes, within 2 weeks, if you're going to ovulate and all factors remaining constant, the atmosphere was correct, it's possible you can conceive immediately.
Right.
Yes.
All right, we are finishing up on the issue of weight gain. But just before I could allow you to do that, we are going to pick yet another call. Yeah, from Charles. Hello, Charles.
Hello, how are you?
I'm okay, and you?
I'm very fine.
All right, go ahead.
So my child was diagnosed with Edward syndrome
Yeah.
3 months ago. So, okay, my question was that I have fears that the same situation might reoccur, and what can my wife do so that at least ajaribu kuweka remedy to avoid the same thing to occur again?
Okay, thank you, Charles. You've heard him. Yeah.
I think it's quite a coincidence that we have 2 callers with the same issue. I don't know if they are related, but if seeing as I don't think he caught us in the earlier part of the program, naturally, it's very limited what we can do to prevent Edward syndrome in subsequent offspring, but also understanding that the fact that you have one child with a genetic problem doesn't necessarily mean that the next offspring is going to have. If the concern is very, very big, the only way we can prevent would definitely, it not be a natural pregnancy. They'd have to undergo an IVF cycle. During the IVF cycle, a biopsy is going to be taken from the embryo, and it's going to be tested for the genetic makeup of the embryo, and only embryos that do not have features of the genetic malformation, those that are normal, are going to be returned. But it's also understanding that pregnancy is not guaranteed during an IVF cycle, and it's also quite expensive. The total process would something be close to 1 million shillings, just because a cycle itself is about 400,000. Doing the biopsy, the specimens are flown abroad. It's quite an expensive process.
Right.
Yes.
All right, Doc, can you finish up on the issue of pregnancy and weight, maybe?
Okay. So I think we had talked about both weight loss and weight gain. So
how can both affect the baby?
Okay.
When someone
so
is,
fortunately, unless the mother has a very, very severe problem, embryos and the placenta are very, very efficient organs. To the extent, if you look at even babies born in drought and famine-stricken areas, at birth, majority of these babies are actually normal. They start getting the features of malnutrition once they're born. And the reason being, the placenta is a very efficient organ and can actually take a lot of nutrients from the mother, even when she's lacking. And the placenta will harvest and get those nutrients from the mother. So you find, unless maybe medication or something, extreme weight loss or weight gain generally will not affect the embryo per se. Having had said that, you find that people who have now disorders, things like bulimia and stuff like that, getting pregnant would be a problem in the first place.
Right.
And obviously, if they are pregnant, they can have a higher rate of miscarriage. But if they don't miscarry, the placenta is a very efficient organ, will actually get the nutrients it needs from the mother. Yeah.
And one of our viewers is asking, is it safe to have intercourse when pregnant?
There's no contraindication unless the woman is having a threatened miscarriage. So early pregnancy, she's bleeding, or she's somebody who's lost pregnancy at various times. So other than any obstetric complication, right, we actually would not say that there's no reason why the marital relation should not continue during the pregnancy, in a normal pregnancy.
Okay. And hi, Doc. Thanks for the nice show. Got a question. I'm a bit confused of my situation. I have a 1-year-old kid and just realized I am pregnant a day ago with IUD. Went to hospital and it was removed. I'm so worried. Kindly advise Caroline.
Okay, so definitely, I think whoever did it is a very informed person, because what we say, and I'm going to maintain that despite being on some form of contraception, pregnancy is still a possibility. And we say the statistics for an IUD is if I have 200 women who are using an IUD, one of them may actually fall pregnant. So if we're in the first trimester, which she said it's about a month ago, so she sounds like she's the first trimester, what we are advised to do is to do a pelvic examination. And if in the pelvic examination we're able to clearly visualize the strings of the IUD, then we are advised to remove.
And then, Doc, let me just cut
to
you
remove
short.
the IUD.
Yes, just let me cut you short and then we are back. Let me just receive one call, then we can combine the two questions. Hello? Okay, we can go ahead and ask,
yes.
answer the
So,
Caroline.
like what I was saying is that if you're able to see the strings of the intrauterine device, then we are actually advised to remove it. If we're not easily seeing the strings, then we just will advise the woman that we're not able to see the strings, we'll leave it. They say if you remove it, miscarriage rates are lower. However, we have had people who have had the IUD the entire pregnancy and have been able to carry through. So it's that it was removed. I think the right thing was done. So it has reduced the probability of a miscarriage in the course of the pregnancy.
Okay, thank you for that. And hi, Doc, I am Saika. I am Faith from Saika, sorry, and I'm asking the doctor how FemiPlan method or family planning is effective because I'm using BT and somehow in fear. I think it's a little bit...
Okay, I didn't quite get, she's using BT?
Yeah, she's asking how effective is family planning. Maybe she's using it, she doesn't want to get pregnant.
Okay. The challenge, I think, with FemiPlan, they have different products that come under the name FemiPlan, but I'll assume the most common will be the combined oral contraceptive pill. So a contraceptive pill is very effective, but with correct use.
Right.
Now, correct use entails that you have to take your pills on a daily basis, more or less the same time, and not miss. And you find if you do that, it's a highly effective form of contraception. However, normal use, I think normal human beings, we occasionally forget. And we may forget at a crucial time in the cycle, and you can find that you're pregnant. But I'll still maintain, even with correct use, there's still a slight probability of pregnancy, but they're highly effective methods, and I would encourage her, if she's comfortable, she has chosen that method, to continue using it.
Okay, I think there's one of our viewers bringing in the issue of blood grouping and pregnancy, and they're asking, hi doc, can people with the same blood group give birth to a normal child? Please help me.
There should be no problem if you have the same blood group, because you have no issues of any form of incompatibility. So unless there's another problem, I don't think the blood group would be the issue. Yes.
And there's the issue of the rhesus factor
Yes.
issue. If you have a positive and negative, there's a probability of getting. Maybe you could highlight and ask more about that.
Okay, I think that would be a whole show.
I know.
So maybe you can think of doing that in the future.
Yeah.
But the main issue is if we have the woman is rhesus negative, and especially if her spouse is rhesus positive. So if you have that the spouse is rhesus positive, it means that offspring can either be rhesus negative, like their mother, or rhesus positive, like the father. I don't want to go into too deep because there's all sorts of connotations. So if you find you have a rhesus positive child, there's always exchange of blood between the mother and the fetus during the pregnancy. So the mother will always recognize positive blood, despite this being her child, as being a foreign body to her, and will always produce antibodies towards positive blood. So that's what happens in the issue of rhesus negative and rhesus positive.
Okay.
Fortunately, first pregnancies, because the reaction takes a long time to, the antibodies take a long time to develop, the first baby may not necessarily be affected because of this, but you find should good precautions not have been taken in the course of the pregnancy to prevent this from happening, subsequent babies can be affected.
Okay. And hi, Doc, I have had 3 CS. Can I get pregnant with a 4th child?
In terms of assisting women to achieve their goals, we do try to assist all women to achieve their reproductive goals. So if she's had 3 cesarean sections, we normally allow most women up to 4 cesarean sections. There are women who refuse to have, like, say, a bilateral tubal ligation and use some form of contraception. So there are women who have had even 5, 6 cesarean sections. However, most doctors will start getting very jittery if you're doing more than 4 cesarean sections. So yes, it's possible, but with every subsequent cesarean section that you're going to have, the risks of complications during the delivery are going to increase, and during the pregnancy as well.
Maybe we can pick another one. Hi, Doc. I just tuned in about the, I don't know what the discussion is really about, but I must admit I misused P2 some years back. Right now I'm trying to get pregnant, but it ain't happening. What do I do?
Okay. So P2 is again one of those things that a lot of women are misusing. You'll find every month or every week somebody's using P2. It's understanding the level of hormone in the P2 is quite high, and it should just be used for emergencies.
Right.
So I'd really advise all women who do not have an intention of conceiving and would like to remain sexually active to please just go for proper family planning counseling and choose some form of contraception. In the meantime, if she's having problems conceiving, I just advise her to see her gynecologist. If she doesn't have one, again, she can talk to the producers and they can give her my contact.
Okay. Hi, Doc. I am 3 months pregnant, but I have been frequently getting some infections. I'm worried. Can it affect me or my baby?
Okay. Again, people always use the word infection. Infection is very broad. Is it a cough? I'm sure she's not talking about a cough. Most probably it's a pelvic infection, something like very common urine infections and yeast infection. That's candidiasis. Well managed, they should not affect your baby. Yes.
But is it okay or is it normal?
No, she should get treated.
Yeah.
She should get treated. That's why I've said if it's well managed, it should not affect her baby. If we don't manage to contain the infection, depending on how severe it is, definitely it can lead to more serious complications. But let's her just go see her doctor and get treated.
Okay. Doc, I had a PID and I want to get pregnant. Is it possible?
In life, nothing is impossible, but it's understanding that somebody who has a pelvic inflammatory disease has a high chance of having problems conceiving in the future. So I'll just ask her to, I'm assuming that she has been treated, that to try conceiving in the near future. And because of that history, I would not really actually wait the entire year unless she's very young. If she's in her early 20s, she can do the normal, wait the year. But if she's an older person, I would get her an evaluation just to ensure the tubes are okay and see how she can be assisted to conceive sooner rather than later.
Okay. And hey, Doc, I got pregnant three months ago post-CS. Will it affect this pregnancy?
Okay. She's pregnant 3 months ago, but I don't know how long ago the cesarean section was. So it's, again, really understanding wound healing. Proper wound healing will take place in about 3 months. That's about 81 days, 81 to 90 days after whatever it is. So you find anything that happens after that is not going to change how the healing has taken place. Having had said that, at 3 months, your baby is still breastfeeding. Even people who have not had a cesarean section, we normally advise a birth-to-birth interval of about 3 years.
Okay, Doc.
Yeah.
Is it okay if I receive that call?
No, just receive the call.
We have Lee from Kasarani. Hello, Lee.
Hello.
Oh, Lynn. Hi, Lynn.
Yeah.
Yeah.
I'm fine.
I'm fine too. Go ahead.
I just need to I just wanted to work.
Mm-hmm.
I had an infection on PID,
Okay.
and I got a cystectomy done.
Mm-hmm.
I wanted to know how long will I take to get pregnant, because I was done on April.
Okay.
I just wanted to know how long will I take to get pregnant.
Okay.
What operation did you have, Lynn?
Hello, Lynn.
Hello?
The doctor is asking the kind of operation that you went through.
Cystectomy.
Or cystectomy?
Yeah.
Okay.
Okay. Thank you so much.
Okay, thank you, Lynn. So if she's had a cystectomy, again, it depends. Was it an open or laparoscopic procedure? The laparoscopic procedure, we expect her to heal much faster than in an open procedure. You find for most open procedures, a month, 2 months, because of healing of the wound and stuff, will be the time frame we'll say before she's able to be sexually active.
Right.
So a cystectomy, usually I'm assuming the cyst was on her ovary. We have not operated on her uterus. So there's no bearing on how soon she wants to conceive. So I'll say if she feels she's ready and she wants to conceive, if it's opened, it would just be to wait until she feels ready and strong enough to engage on sexual activity, and she should be able to go ahead, noting that surgery is a risk factor for infertility, so the sooner she embarks on it, the better. But if I was to be asked just a cut-off figure, I'd say at least give yourself 3 months rest, embark when you feel you're strong and ready.
Okay.
Yes.
Hey, doc, I got a lot of boils on my genitals when I'm almost getting my periods or after periods. What could be the problem and what should I do? Thanks. I think we can just answer
Okay.
her.
So this is somebody I'd really request to really find out things like diabetes and forms of immunosuppression, of which diabetes is one of them. Other infections like HIV, just screen. I'm not saying they have those infections, but there's no harm in screening and making sure that is not the case. And also look at what is the mode they're using to remove the hair in that region. You find a lot of people who shave, wax. Because of doing that, they tend to get a lot of what you call folliculitis, because it's the boils is just the hair, the follicle gets infected, and there'll be many follicles. They grow together, and you get boils. So it would be maybe change the mode of how she's removing the hair in the pelvic area, and just screen for sugars and HIV.
Okay. And as we wind up, Doc, maybe you could list or highlight, list a few steps on how you can take care of yourself and also the baby during the first trimester.
Okay, so I think for those who have just joined in, as we have mentioned earlier in the pregnancy, first I'd start before you're pregnant, see your doctor so that we can screen for some of these things and stop some habits that are not that are known to be harmful. And definitely we advise that you should not smoke, take alcohol, or hard drugs even prior to conception. Once we're pregnant, of course, we're going to maintain the same. Just eat a healthy, balanced diet with more dietary fiber, so that would be green leafy vegetables, fruits. Hydrate well, take about 2.5 to 3 liters of fluid every day, and exercise. And the simplest exercise would be a brisk walk, 30 minutes on a daily basis. And just be good to everybody and enjoy life.
Okay, Dr. Maureen Owiti, you always make time to this show.
Yes.
We can't say enough thank you, but thank you so much for coming today and having that informative discussion. We look forward to having you once again.
Always looking forward to meeting you, Purity.
Yes, and, and that's all the time we had for the show today. Thank you so much for your contributions, your feedback, your questions, your calls. We do appreciate. Remember, My Doctor Show continues next week, Monday, Tuesday, and Wednesday, 10 a.m. to 11 a.m. My name is Purity Museo. You can always download our previous episodes from our YouTube channel. Simply go to Ebru TV Kenya or Purity Museo and choose the episode of your choice. God bless.